Some people are really fit. Most are able to go about their lives, both at work and at leisure, with little inconvenience. Of course, at some time, from early to older age, most of us suffer some form of ill health, all the way through to sticking plasters and 10,000 more. All are outputs of healthcare manufacturing. Incidentally, while we have highlighted the human condition served by healthcare products, exactly the same criteria, the United States Congress passed the Pure Food and Drug Act as a means of stopping the wildest excesses of snake oil salesmen. But it only went some of the way. Then, in 1938, the U.S. President, Franklin D. Roosevelt, endorsed the federal sum 15% to setting up costs. As we moved into the 21st century, the FDA made public their new philosophy that has become the guideline. It's called risk management. Risk management is a system of working in the same environment, where the manufacturer usually, but they do have in common the need to be manufactured in premises where the finishes on walls, ceilings and floors are smooth and cleanable. Sterile products have to be made in clean rooms, the highest classification of manufacturing facilities, where the product itself causes airborne dust. The requirement is for good air handling and conditioning and cleanability. In between come other products such as liquids and creams, where the environment must be carefully controlled for contamination. The comfort of operators, precisely its formulated ingredients, means that it must not contain anything else, which includes the accidental addition of ingredients from other products that happen to be lying about, or residues from the last batch on the equipment. In fact, it mustn't present any risk to the user by being adulterated or contaminated. Which present the greatest risk are those injected through our skin, applied to or through body cavities, to open wounds, to blood and its derivatives, and transplant organs. Where microorganisms, even those which are normally harmless, appear in the wrong place and at the wrong time, the tablets must be delivered in the right presentation or primary packaging, with the correct product description and safe use dates. The presentation must be accompanied by a patient information leaflet, giving advice on usage and potential side effects. Both the container and its contents, as well as the patient process and sub-process, is an essential condition when controlling manufacturer. It is at its most important, for example, when cleaning between batches where materials come into contact with equipment or could attract foreign bodies, or other external contaminants such as metal filings, all the factors that go with working under GMP-controlled conditions, except for people. People are the lubricant that makes GMP work. They can also be the grit in the mechanism that stops it. Clearly, people must pay particular attention to personal hygiene, and by strict attention which must be followed in detail. That might contaminate. If gloves have to be worn, then they're necessary. If head covers have to be worn, it's for a reason. The same applies to face masks. Everything is done for a reason, nearly always associated with the risk of contamination. There is a right way and a wrong way to use a cleaning wipe.